Okay, I'm preparing to give an NG2 for the enteral nutrition. I am confirming that the doctor did order it. I'm comparing his orders to the MAR. I'm getting all of my equipment prepared. So this is going to be me getting all my equipment prepared. All right, perfect. So I did verify that. I'm going to go ahead and perform hand hygiene before entering the patient's room. I'm performing hand hygiene. I am gathering all of my supplies. So I have everything I need. Okay. And so now I'm going to knock on the patient's door. Hi, my name is Tamika. I'm going to be your nurse for today. I'm here to give you your NG tube insertion. So for your abdominal distension. So before we proceed, how are you doing today? Okay, that's awesome. May I have you to verify your name and your date of birth? Susie Fowler, date of birth 10/13/1979. Perfect. I'm going to change your arm bracelet. Okay, perfect. I'm going to go ahead and scan it. Okay. All right, perfect. And I'm going to go and do my third check. All right, perfect. I got that. Susie Fowler, 10/13/79. Okay, have you had this procedure before? Have you ever had the NG tube inserted? Okay, no. Okay, so this is your first time. Okay, so what we're going to do is we're going to go ahead and I'm going to check a few things. I'm going to check your cough. I'm going to check your gag reflex. And then I'm going to also check and see if you can swallow anything. So I've got some water for you as well, okay? So now I'm in the room. I'm going to perform hand hygiene in front of the patient. Excuse me. Sorry. Okay. So the first thing I like to do is see if you can cough. Okay, well, first things first. Let's get you into, if you don't mind, I'm going to raise your bed here. This is the best we can do. Oh, Jesus. Okay. Yeah, that's as raised as we're going to get. Okay, let's just say it's raised. Okay, so we have it raised. Okay, perfect. Yeah, you're doing great. Okay, and so what I'm going to do is I'm raising the head of the bed so we can prevent any aspirations. Okay, and so I'm going to check your gag reflex. So can I have you to cough? All right, perfect. That's great. So I'm also going to use this tongue depressor, and I'm going to check the patient's gag reflex, okay? Do that, okay. All right, perfect. And I apologize for any of that discomfort that you may have experienced right there. Okay, so now what I'd like to do is go ahead and start the process of actually preparing the NG tube. The first things I want to do is I want to actually measure the tube. Okay, so I'm going to do that. So when I measure the patient's tube, I'm going to measure from the patient's nostril to their earlobe. And then I'm going to take that down and I'm going to take it from the earlobe, to the xiphoid process. Okay. And then I'm going to use a piece of tape that I have right here. And I want to hold that spot because that's where I want to actually, stop. So that's how much of the tube I'm going to need. Oh gosh, hold on. All right, perfect. Okay. Excuse me. Should have brought scissors with me. Okay. So using a piece of tape. Okay, so I have that. So now I actually am going to need to check and confirm that the patient can swallow. Okay, the patient swallows well. So now I'm going to put on some gloves. Okay. So I'm preparing. Get everything set up. And I am now preparing my supplies. In this case, I would have normally prepared it for the water, but this one already came pre-filled with water. So I already have it where I need to stop. So now I'm going to take it and I'm going to take my pre-filled water syringe, take the top off. I'm going to do 10 ml of water. And okay, so I was able to do that. And so now I'm going to put some lubricant on my adhesive lubricant. I'm going to put the lubricant on there. And so I'm going to prepare the patient to now begin to, because the tube is ready to go in, and I'm going to insert the tube in through the patient's nostril. So, before I do that, I apologize. I'm so sorry. I was supposed to check the patient's vitals. So, I'm going to check the patient's blood pressure and vitals. Can't believe I'm doing that thing. Okay. And the patient's vitals are normal. So now I can prepare to do the insertion of the tube. So I'm going to make sure I already have the lubricant on there and tell the patient to continue to drink. There will be another person here making sure the patient can drink because it's only me. So we're going to just pretend someone else is there. And I'm just going to go ahead and make sure it goes all the way back. Okay, sorry for being a little uncomfortable, Mr. Fowler, but you're doing really great. Let me know if you feel any discomfort, this tubing. All right, perfect. And now I want to check for aspiration to see. All right, perfect. I need scissors. Okay, just give me a moment. Okay, and so I'm just going to. Okay, I got that tape right there. Okay, positive. All right, perfect. And now we're going to check and see if we have any type of aspirations for the patient. And we're doing that. And there's no air. All right, so the tube is in there. And so now I'm going to prepare to go ahead and secure it. So I have pulled out the 10 inch. And what I'm going to do is put this on the patient's nose. This will only take a half. So sorry. Okay, and I'm going to fold this piece up while I remove. Sorry. Okay, let's start this over again. There we go. Put it up. Put this piece up so we can get it to secure. And go ahead and remove this one. In this case, we won't be able to. I'm going to go ahead and remove it and get it over here. Get that secured over here. And then over here, we would apply adhesive onto the skin, but in this case, we'll put some more tape. Yeah. Okay, perfect. Okay. In this case, we would have added some facial adhesive here. Making it do what I have. Sorry about that. Okay. Now I want to go ahead and get it clipped. So we'll just say this one is clipped. So sorry. All right. And then that is how we would go ahead and insert. So what I'm going to do now is clean up my supplies. Okay. All right. Have the patient drink some water. Okay. All right. And I do want to perform oral hygiene on the patient, so I got my supplies up cleaned up. All right. And then I'm going to remove gloves. This is me removing gloves. In this case, I don't have a second pair, so I'll go ahead and hygiene on this. I put on new gloves because I'm going to perform oral hygiene for the patient. Okay, so I have a toothbrush, toothpaste, and brush teeth of the patient. Brush up, brush up, brush up, brush up, brush up. Okay, go ahead and let the patient spit in my cup. All right, give me some water. Okay, let me spit it all out. Okay, perfect. So ask the patient, are you comfortable in this position, or would you like me to lean you back again? All right, perfect. I'll get you lean back. Just hold your back on so you don't aspirate. So we're gonna check on you, leave it in this. Can't put you all the way back here. And then I also have, also would like to leave the call light for you. So if you need to call or anything, just let us know, and I'll be right back in with you. Okay, so I'm gonna take my supplies. All right, now I'm going to document. Remove my gloves, sorry. Document that patient tolerated it. I show the order, show that it was confirmed by x-ray, confirm that it was placed and the patient was able to tolerate it, and it did take in one take. I did only had to do it one time. All right, and that's how you insert an NG tube. Thank you.